All right, welcome back. Today we're continuing our BCBA exam practice question series with part 48. We're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please go to behavioranalyststudy.com. We have 3 practice exams, a task list study guide, and our combo pack. When you pass your exam, please let us know so we can include you in our Sunday shout out. Other than that, let's work hard, study hard, get to our questions. Question 1. Glenn Ross is motivating his sales team. He tells his salesman that every day he wants them to call 2 or more people than they called the day before. Whoever does this each day for a month will receive a bonus on their next paycheck. Glengarry is using what procedure? All right, so we're looking at Glengarry's intervention. And if we see our answer choices, is differential reinforcement, right? He's using some sort of differential reinforcement intervention. So we have to determine which one that might be. Now, when we have differential reinforcement questions, we have to remember just a few things, okay, that will help us quickly eliminate some answers. First off, always ask yourself, are we teaching a replacement behavior? If we are teaching a replacement behavior, then it's typically going to be a DRA or a DRI procedure. If you aren't teaching a replacement, then it's going to be a DRO, DRL, DRH, or DRD. Because those, they don't teach replacement behaviors. They focus on increasing or decreasing behaviors that are already occurring. So in this case, is Glenn Ross teaching replacement? Well, no, he's motivating his sales team. So he says that he wants them to call 2 more people than they called the day before. So we're just increasing the calling behavior. So we can eliminate DRA because we're not teaching an alternative. Okay, we're just increasing the behavior that already exists. So since we're increasing that behavior, are we looking at a DRO procedure? No. A DRO procedure picks a target behavior and then reinforces anytime that behavior doesn't occur. We're trying to decrease that target. We're not doing that here. Okay. We're setting a criterion, setting an interval, and then reinforcing if their behavior goes above that criterion. So are we looking at DRL? No, a DRL, we'd be setting lower criterion in an attempt to decrease this behavior. Glenn Ross is setting a criterion to increase the calls. So he says he wants them to call 2 more people than the day before. That's the criterion. And then if they do that for a month, they're going to receive a bonus from the next paycheck. So Glenn Ross wants to increase calling behavior. He's setting a higher criterion each time to increase. And then he's going to reinforce for that behavior occurring. Glenn is using what procedure? DRH, differential reinforcement of higher rates of behavior. An impressionist is learning how to impersonate Adam Sandler for a comedy show. He wants to learn Sandler's body language and the way Sandler speaks. He asks his friend to work with him and tell him each time he is closer and closer to looking like Adam Sandler. Shaping is occurring blank. The great part about this question is they tell you right up front you're looking at shaping. Okay, so shaping, what is shaping? Shaping is reinforcing approximations of behavior, right? Closer and closer approximations to the behavior we want to see. Now, we can shape across topographies, within topographies. We can change dimensions of behavior. All kind of things can be done with shaping. Shaping is very powerful. In this case, we need to identify what kind of shaping are we using? What's the goal of the shaping procedure? Well, we know this impressionist is learning to impersonate Adam Sandler, and he wants to learn body language and the way Sandler speaks. And each time he gets closer and closer, he wants his friend to praise him, basically, tell him, right? So he wants to continue to change the way his behavior looks. So is that going to be within topographies or across topographies? If you're continually changing how the behavior looks, you're shaping across topographies. Think about across topographies as kind of the standard shaping procedure that you would think about. Okay, you're trying to get to that terminal behavior. You're not there yet. You're reinforcing closer and closer approximations each time the behavior looks a little different. Within topographies, you're assuming we already have maybe the target behavior we want. We just need to change a dimension of the topography. Maybe we need to change the magnitude or the latency, the rate. We need to do something with the behavior that already exists. We're not necessarily changing how it looks within topographies. We're changing a dimension. In this case, we need to change continually how that behavior looks. Okay, so we're shaping across different topographies each time, creating brand new responses and new response topographies. Obviously not shaping across functions. And then D, none of the above. Well, that's not going to be the right answer because shaping is occurring across the topographies of these different body language and the way he's trying to speak. Mary's session notes include the following passage. When I arrived at session, the client was eating breakfast. Mom asked him 3 times to pick up his trash and received no response. The 4th time she asked, he screamed. The client was visibly frustrated at this point. I prompted the client to pick up his trash and provided reinforcement upon completion. What should not be included in her session notes? All right. First things first, let's slow down. This is a good example of why we always do our work up front in the question. A lot of people, what they want to do when they read this question, they want to read all that information and then they just want to jump into the answer choices, right? And I'll just go figure out in the answer choices. What ends up happening is you start going back and forth, right? You read an answer choice, you go back to the question. You have to read the question again. You end up reading the question over and over again, never really comprehending what they're asking. And you're just playing a little game where you're just trying to figure it out. It's not meant to be figured out, okay? You're meant to analyze the information they give you and then pick the best answer. So that's what we're going to do. We're going to analyze the questions, use our analysis to predict the answer, and then get our answer. So we're looking at session notes. What do we know about session notes? Session notes are essentially medical documents, right? They need to be objective, they need to be clear, and they need to tell you exactly what happens, okay, at each session. Session notes are not a time for opinions and stories and things like that, okay? We need objectivity. As a behavior analyst, I just need to know exactly what happened, all right? So let's look at the session note. When I arrived at session, the client was eating breakfast. Okay, good enough. Mom asked him 3 times to pick up his trash and received no response. Good way to describe behavior. Okay, we're not describing any mentalisms. This is exactly what happened. Pick up trash, no response. The 4th time she asked, he screamed. Perfect. Now we know what his response was. The client was visibly frustrated at this point. Stop there. Why is that an issue? Well, because visibly frustrated, not only is that just a mentalism, it's also very subjective. How am I supposed to know what visibly frustrated means? Do we even know if he was visibly frustrated? Maybe the technician, their perception was frustration when the mom thought maybe she was just playing. Okay. This should not be in here. Okay. It doesn't tell you anything useful about what you need to know about the behavior. I prompted the client to pick up his trash, good, and provided reinforcement upon completion. The rest of the note is great. The part about the frustration is not. It's not going to do anything but hurt your assessment. But we need to leave this part out. Just leave it at the 4th time she asked, he screamed. That way, when you go out for your supervision, you have an idea of what happened, and then you can conduct your direct assessment. So, what should not be included in the session notes? A, when I arrived at session, the client was eating breakfast. Totally fine. B, mom asked him 3 times to pick up his trash, received no response. Again, totally fine. C, the client was visibly frustrated at this point. That is what we are going to eliminate. It's a mentalism. We can't measure it. It's subjective. Doesn't belong. D, I prompted the client to pick up his trash and provided reinforcement upon completion. Great. Rest of the session note is excellent. Problem here is this mentalism that we can't measure, and it's subjective. It's not going to help us. Every 6 months, Miranda receives her favorite bottle of wine from her boss as a thank you gift for her hard work throughout the year. The last 2 times Miranda received this gift, her siblings drank the entire bottle when they visited for the weekend. Next time her siblings visited her, Miranda hid the bottle and served other wine. What type of intervention did Miranda implement? All right, pretty easy question. Maybe a 2 or 3. Difficulty. Pretty straightforward, right? So we're looking at Miranda and her intervention. What do we know about Miranda and her intervention? Well, she received her favorite bottle of wine. She knows, Miranda does, the last 2 times she got that gift, whenever her siblings came over, they drank the entire bottle. So this time she's prepared, she's being proactive, and she's going to hide that bottle and serve other wine. So when you're proactive, when you're anticipating a behavior and you're doing something to prevent the behavior from occurring, what kind of intervention are you implementing? A, antecedent. Yes, this is an antecedent intervention. An antecedent intervention is preventative, it's proactive, it prevents behavior from occurring. A consequence intervention is reactive, okay? We're not sure how she reacted last time they drank the bottles. All we know is this time, she's going to do an antecedent intervention and prevent that behavior from occurring. This is what we need to be doing more often. A lot of antecedent interventions, consequence interventions, they're reactive, they affect future behavior, they do nothing about the current behavior. Okay. So we need to do a lot more proactive strategies in controlling behavior. Avoidance is not an intervention, it's a function. Differential reinforcement. Well, we're not sure if she's teaching an alternative, if she's reinforcing anything. All we know is she's taking action before it happens, making it an antecedent intervention by hiding and serving other wine. So, what type of intervention did Miranda implement? Well, A, antecedent. A student has learned to discriminate between several written words, such as apple and tree. To test that the word apple has appropriate stimulus control, you would present apple in what context to the student? In order to answer this question, it's very important that we identify what is appropriate stimulus control. And when we say stimulus control, we mean a behavior is occurring in the presence of that stimulus. Okay. So the rate change or the frequency changes, we want appropriate stimulus control for behavior. Okay. In a library, whispering should be under stimulus control. Okay. On the playground, now we have loud noises, running, etc. In this case, several written words have been learned by your student. They can read apple, they can read tree. What would appropriate stimulus control be for reading the word apple? Well, it's going to be the word apple. And when we say that, we mean we don't want them to be able to read the word apple in the context of a paragraph or in the context of other fruit words where they're using different stimulus to evoke that response. We want the word apple to evoke the word apple. That's appropriate stimulus control. So if we're going to test that appropriate stimulus control, how are we going to do that? A, in a sentence, such as, a red fruit is an. What's the issue here? Well, it's no longer under stimulus control of the word apple. It's now under stimulus control of a red fruit is an what? It's essentially an interverbal, right? So, because they're just answering this question. So it's under the stimulus control of the question. It's not what we're looking for. B, in the context of a book. Well, a lot of people can read words in the context of a book because there's context clues, they're in sentences, that kind of thing. And then you pull the word out and it becomes a lot more difficult. So we don't want to see them reading apple in the context of a book at this time. We just want to make sure when you show them the word apple, they say apple. C, present apple randomly with other words mixed in. Yes, okay. So let's say flashcards. Here's a word, here's a word, here's a word, here's the word apple. They say apple. When they see just the word apple, we now know we probably have stimulus control. Now, perfect stimulus control is very hard to prove, obviously, okay, because you could argue, well, the flashcard, blah, blah, blah. We get that, but the best approach and what's going to be at least the most accurate is just putting apple by itself and hoping they read the word apple. With other fruit words, of course, you can use a lot of different clues. It's under the stimulus of a category, a lot of different things, okay? Not what we're looking for. This is a tricky question, okay? You've really got to think about what would appropriate stimulus control be? What does it look like? And how would I really test for that? And how you would test for that is make sure you're only showing the word apple. And then when they see the word apple, they read apple. Then we can say with reasonable doubt that we have stimulus control. You organize a staff training on a positive behavior support intervention. The training lasts a month and then a 2-week data collection period takes place. Data indicates that staff is implementing the intervention with high fidelity. What should be your priority as the supervising BCBA? All right, this is staff training, supervision. It gives people trouble, okay? What I always tell everybody is to remember your staff training, your staff supervision, it's just like client work, okay? You need to model, you need to plan, you need to reinforce. It's all it is, okay? So in this case, you've trained, right? You've trained on the positive behavior support intervention. The training lasted a month and then 2 weeks of data. Great. The data indicates the staff is implementing the intervention with high fidelity. Everything is going great. It would be just like if you had an intervention for a client and your data indicated everything was going smoothly. That would be fantastic. In that case, what would you want to do? If you see your client's behavior and it's the behavior you want to see, you want to reinforce it, right? It's no different with staff. Your data says your staff is implementing the intervention with high fidelity. We need to do something to maintain or increase that fidelity. So, what is your priority as the supervising BCBA? A, deliver punishment on an FR1 schedule for staff not implementing with fidelity. Now, why would we jump to punishment? That doesn't make any sense, right? The staff is already doing what you want them to do. There's no reason to start implementing punishment. B, continue training current staff as well as new staff. Well, not really what we're trying to do here. Okay, we're focused on the fidelity of this intervention. You've already done the training, okay, with the current staff. They're already intervening. They're doing it the right way. We need to figure out a way to keep that going. C, start to fade the intervention slowly. If the intervention is effective, we're not sure if it is or not, but there's no indication we need to fade it. And then D, determine how to maintain the high fidelity of treatment. That's what we're looking for. How can we figure out a way to keep this great fidelity going? That is our goal here. Okay. How do we maintain the high fidelity of this treatment? Sophie needs to determine the function of her client's running away behavior, which occurs during snack time and during reading time. Sophie is responsible for 10 other children. She also has limited resources at her disposal. What will be the worst assessment for Sophie to choose to assess the function of the behavior? All right. This is a common sense question. Okay. It's one you can easily overthink. So when you're in this situation, let's make sure we aren't overthinking these type of questions. What do we know? We need to know, or we know that Sophie has to choose a way to assess the function of the behavior. However, we also know she has 10 other children and she also has limited resources. Okay. So what can she choose? How about an ABC narrative recording? Okay, it's continuous, so it's going to be a little tricky, but reasonably, she should be able to at least get some ABC data on the child. Be a brief functional analysis. Brief functional analysis might take 10 minutes. Okay, so can she find 10 minutes? Maybe. It's probably worse than ABC narrative recording, but it does seem realistic. What about a full functional analysis? A full functional analysis does not seem feasible. Why? Well, she has 10 other kids and she has limited resources. A full functional analysis takes time, it takes resources, it's intensive. Sophie does not appear that she could ever pull off a full functional analysis. If she tried, it's probably just going to do more harm than good. And then event recording, easily pull off event recording. Okay. So while these are all going to be difficult giving Sophie's situation, the worst would be a functional analysis. There's just no reasonable way Sophie could do this accurately and get and pull off a good assessment. So, given her time, her resources, and everything we have to consider, the worst assessment would be a functional analysis. Alexander and Thomas are playing in the sandbox together at recess. Alexander grabs Thomas's toy truck, throws it across the room, and the toy truck breaks into pieces. The teacher tells Alexander he needs to pick up the pieces, put the truck back together, and then wash the dishes in the classroom sink. What type of punishment does this most closely resemble? Looking at a punishment procedure here, think about all the punishment procedures we know, right? Overcorrections, timeouts, positive punishment, negative punishment. What we know is Alexander and Thomas played in the sandbox. Notice how each time we're asking ourselves, what does the question want us to figure out? And then what do we know? Okay, it forces us to really analyze the question. Alexander grabs Thomas's toy, breaks it. Teacher says, okay, pick up the pieces, put the truck back together. Okay, fix what you broke, and then wash the dishes. So in addition to you fixing what you broke, I also want you to wash the dishes. What does that most closely resemble? A, positive practice over correction. With positive practice, we would be making Alexander engage in the right behavior over and over again. Not what we're doing. With negative practice, we would be making Alexander engage in the wrong behavior over and over again. Again, not what we're doing. Restitutional overcorrection is what we're closely doing, meaning you threw the toy truck, I want you to fix it, and then fix other parts of the environment better than they were before. That is restitutional overcorrection. It isn't timeout, okay? It's an overcorrection procedure where we're making Alexander fix what he broke and then do other things to fix the environment. So what type of punishment does this most closely resemble? Well, restitutional overcorrection. All right, thank you so much for watching. Please check out behavioranalyststudy.com for our study materials. We also have a join button if you'd like to support us further on YouTube. As always, questions, comments, let us know. Let us know when you pass. Work hard, study hard. See you soon.